All right, let's dive into a real medical investigation. We're going to crack open a case file on a drug that's supposed to be a hero in the operating room, but, well, it might just have a dark side. So here's the mystery we're tackling today. We have this drug, and it's fantastic at stopping bleeding. But what happens when you use it during some of the most dangerous, high-stakes surgeries out there? Could it actually be causing a new, even deadlier problem? Yeah, you heard that right. Let's start by heading to the scene of the crime. So, every good investigation starts at the crime scene, right? For us, that's the operating room during a really complex vascular surgery, where, believe me, the stakes could not be any higher. Just picture it. The surgeon is working on one of the body's main blood pipelines. It is an incredibly intense, high-pressure situation. Because in this world, the number one villain, the biggest and most immediate threat to the patient, is uncontrolled bleeding. Every single drop counts. The specific procedures we're really digging into are called non-cardiac arterial procedures, or NCAPs for short. Think about repairing a bulging aorta. That's the body's main artery. These are some of the most challenging surgeries you can imagine, and it's all because the risk of massive, catastrophic bleeding is just so incredibly high. Now, in this story, every hero is also a suspect. So let's meet our lead suspect, Tranexamic acid, or as we'll call it, TXA. This is the drug that's supposed to swoop in and save the day. So how does this stuff actually work? Well, when you get a cut, your body naturally forms a blood clot to plug the hole. TXA basically acts like a tiny microscopic construction crew. It rushes in, finds that clot, and reinforces it with like microscopic scaffolding, preventing it from breaking down too soon. It just makes your body's own natural defense way, way stronger. And look, TXA already has a stellar reputation. I mean, in heart surgery, it's an absolute superstar. It's proven to reduce bleeding, cut down on the need for transfusions, and even lower the chances of having to go back into surgery. And this is the key part. It does all that without causing dangerous blood clots. So the big question is, why on earth wouldn't it be just as heroic in these other major arterial surgeries? To solve this mystery, researchers really had to put on their detective hats. They launched a massive investigation to gather every single piece of available evidence they could find. Now, their method is something called a systematic review, which is basically like meticulous police work but for science. First, you define your key question. Then you search everywhere for clues, in this case, scientific studies. And then comes the hard part. You rigorously filter and assess everything to find only the most reliable, trustworthy evidence. And their initial search cast a huge net. I mean, look at this. They pulled in almost 4,000 potential leads, which, after a first pass, they managed to filter down to just 15 promising reports. And after some really intense scrutiny, only 5 of those studies were considered high quality enough to make it into the final analysis. Think about that. From nearly 4,000 leads, the entire investigation now hinges on just 5 crucial pieces of evidence. So, the moment of truth. What did these 5 critical pieces of evidence actually tell our detectives? Well, this is where the plot really starts to thicken. It turns out the clues were all over the place. I mean, completely different directions. For some of the biggest, riskiest surgeries, like repairing an aortic aneurysm, TXA seemed to do nothing, no difference. But then, in a surgery on the carotid artery in your neck, it clearly worked. It reduced a dangerous type of bleeding called a postoperative hematoma. What a mess, right? A total mixed bag. And this conflict in the evidence gets even starker when you look closer. For carotid surgery, 2 studies pointed to a clear benefit, less dangerous swelling. Awesome. But for the other major arterial surgeries, 3 different analyses found no real effect on major bleeding or the need for transfusions. This just begs the question, why would the drug work in one spot, but not the others? Is the bleeding in an aortic repair just too massive for the drug to handle? Or is there something special about the blood vessels in the neck? These are the new questions driving the investigation. Okay, with all these conflicting clues on the table, it's time for the investigators to step up and deliver their final verdict. But before anything else, they had to answer the single most important question. Is our lead suspect, TXA, secretly a villain? Does it cause the one thing vascular surgeons fear most? Deadly blood clots. And the verdict is in. On the most serious charge, TXA is completely cleared. The combined evidence showed that using this drug does not increase the risk of those dangerous blood clots that can travel and cause a stroke or a heart attack. Phew,
That is a huge, huge relief for everyone.
Okay, so it's safe. We've established that. But that leads us right to the second, equally important question. Is it actually effective? I mean, does it do the job it's supposed to do and actually stop the bleeding?
And here, the verdict gets a whole lot more complicated. Unproven. Looking across all of these high-risk vascular surgeries, the detectives just couldn't find enough solid, consistent evidence to say that TXA reliably reduces major bleeding or the need for blood transfusions.
So, what does a verdict like safe but unproven actually mean? Well, it means this case is far from closed. What we have here is an unsolved medical mystery.
And what's really important to get here is that the verdict isn't ineffective, it's unproven. There's a big difference. The investigators rated the overall quality of the clues as low to very low. It just means we need more detective work, we need more research to figure out if there are specific patients or certain types of surgeries where this drug could still be a hero. The case file is still open.
And this all leaves us with this really fascinating question that doctors and surgeons wrestle with every single day. When you have a drug that you're pretty sure is safe, but its benefits are still unproven, is that good enough to use when a patient's life is hanging in the balance? That's the messy, complex reality of modern medicine. Thanks for joining me for this one.